In this video, we will talk about the basics of anemia and also go over some of the most common types of anemia, their causes, diagnosis, and management. Anemia is present when either hemoglobin concentration or the number or function of the red blood cells are below the reference levels for the age and sex of the individual. Red blood cells, and especially the hemoglobin they carry, is important in the transportation of oxygen to every corner of the body, providing the substrate to produce energy in the form of ATP. It is important to note that anemia is not a clinical diagnosis, but is rather a physiological abnormality that always has an underlying cause. Anemia is an extremely common manifestation that affects up to 1/3 of the global population. The prevalence increases in premenopausal women, pregnant women, and the elderly. Approximately, the prevalence in individuals older than 85 is up to 20%. Whether or not the patient is symptomatic depends on the etiology of the anemia, acuity of the onset of it, and the presence of other comorbidities. They are non-specific and are shared amongst various types of anemia, and they are also accompanied by signs and symptoms that are caused by the underlying cause or causes. These include fatigue and faintness, headaches, lethargy, shortness of breath, especially on exertion, chest pains, and reduced exercise tolerance and palpitations. And some signs like tachypnea, hypotension, tachycardia, and pallor of mucous membranes, nail beds, and palmar creases. This is more notable in the inside of the mouth and the mucous membrane in the eye. Pathophysiology of this condition varies greatly depending on the primary causes, but the main process involves the following: either a bone marrow production defect, meaning there's a hypoproliferation of red blood cells, or there's a defect in the red cell maturation, like when there is an ineffective erythropoiesis, or finally a decreased red cell survival that may be caused by hemolysis or a blood loss. For the initial investigation of anemia, a peripheral blood test should always be performed, and it may include a red cells level, a white cell count, a platelet count, a blood smear, which may indicate towards the diagnosis through a normal cell morphology, and also a reticulocyte count, which is important to evaluate bone marrow activity. The classification is initially made by looking into the mean corpuscular volume of the red blood cell. The normal values oscillate between 80 to 100 femtoliters. A mean corpuscular volume of less than 80 femtoliters indicates a microcytic anemia. The most common cause of this type of anemia is due to iron deficiency, but may also appear in other chronic diseases. A much rarer cause of this could be a sideroblastic anemia or a thalassemia trait. When the mean corpuscular volume is normal, meaning that is between 80 to 100 femtoliters, the anemia is called normocytic, and it is mainly due to chronic diseases. Finally, a mean corpuscular volume of more than 100 femtoliters indicates a macrocytic anemia. And here there are two types of macrocytic anemia: megaloblastic, which is caused by a deficiency in vitamin B12 and or folates, and a non-megaloblastic anemia that is caused by various systemic diseases or toxins. Finally, with the reticulocyte count, we can know whether it is a hypoproliferative anemia that may be caused by defects in the red blood cells production, or a hyperproliferative anemia that may be caused by a premature loss of red blood cells that may be caused by hemolysis or an acute blood loss. On the next video, we will discuss about microcytic and normocytic anemias.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.